Hi, my name is Dr. Martin Gorman. I'm a dentist practicing in the San Fernando Valley for over 35 years, and the emphasis of our practice is on sleep apnea, bioesthetic dentistry, TMJ, and epigenetic orthodontics. Bioesthetic dentistry is the study of natural biologic form and function. The way it was observed in nature by Dr. Robert Lee was that he noticed in his practice that the people with the best teeth and the healthiest systems all had the exact same things in common. And what he did was he put together what he calls the biologic model on this jaw machine of teeth, how they look in the best people, and how they come together and how they function together. And by doing that, those people had minimal wear, no TMJ, no muscle pain, no headaches, no neck pain, no back pain. Everything was really, really healthy, and their teeth were healthy well into their 80s and 90s without any issues whatsoever. And the program that I was involved in at the Institute of Bioesthetic Dentistry was basically a 2 3/4 year program that we studied and worked on patients for that length of time to get certified and accredited to do that type of dentistry to help our patients. Through the course of that treatment of patients, we would make an oral appliance to what we called stabilize the patient's bite and make sure their system, their TMJ, their muscles, their head, neck, and shoulders were all healthy and pain-free. And in the process of doing that, all these patients that we were getting their bites stable, the vast majority of the patients that I was treating at home, all their TMJ symptoms basically disappeared. Whether it was minor popping and clicking or headache, facial pain, headaches that led to migraines, basically these people became very, very healthy with tremendous improvement, and that's when I shifted the way I was treating TMJ to the bioesthetic approach to treating TMJ. And since I've done that, we have about an 85+% success rate with relieving symptoms on all our patients that we've been treating over the years. And what I'm going to do is just give you a little brief show of exactly what I mean on this TMJ teaching board. The way this board is set up is the elastics are the muscles. The white circle up here is the jawbone at the base of the skull. There's a little black dot there, which represents the center of that bone. And the piece of green material here is the cartilage. Now, all our bones throughout our body, anytime two bones come together, there's always a piece of cartilage that acts as a buffer, a cushion, so you don't wear your bone down and you don't have a lot of pain. So there's cartilage between the two bones, the skull and the top of the jawbone. And in here I have this insert, and it says normal. That means this is the normal bite. So when you open and close, all the apparatus up here stays exactly the same in its normal, healthy, functional position, and the teeth come together perfectly. What happens in people with a bad bite, or people with, and most of the people that have TMJ issues, is they have some sort of bite issue, and in this case, this insert is a posterior bite issue. Example, which means the back teeth come together first. So when you open and close, the back teeth would hit first. But our brain is not going to let our teeth bang together, because that's going to hurt us, and that's going to give us pain. So instead, our brain says, I know where your teeth are, so I'm going to avoid hitting in the back in this posterior area, and I'm going to have the teeth come together smoothly so they all touch. And if you notice what happens, when all these teeth come together smoothly, you can see the black dot is not in the center any longer, and the cartilage is in a totally different position. So when you open and close, instead of hitting in the back, your brain just has your teeth, forces your teeth to come together smoothly, and that's how you develop your bite. This is known as an acquired bite. That's incorrect, and it damages all the tissues in the posterior up in the base of the skull. So what we do to treat that is we make an appliance that fits over your teeth, and in the appliance over a period of 2, 3, 4, 5, or 6 months, or even we've had patients for a year, year and a half on the treatment, that we build into the appliance all the inaccuracies and errors that are in your bite. We change in the plastic, which allows your lower jaw to work correctly, and all your muscles to work correctly, the black dot to stay in the center of the bone, and the cartilage to stay in a healthy, normal position. As you can see, the appliance is made up of all the discrepancies that were present in the bite. When that's accomplished, we put models of your teeth on a jaw machine in the position that the appliance has given you, that is comfortable and healthy for you. Then we determine what do we have to do to your teeth to match what the appliance has done so successfully. And when we match your teeth to what the appliance has done, then your teeth will now do the job, and they will become, without the appliance, your teeth will now become normal in their function and position. So we change the teeth to do exactly what the appliance has done previously. Dr. Gorman here again, and what we're going to do now is discuss a little bit about your bite. This is a custom pamphlet that we made because we believe it's very, very critical that all our patients are educated in what their symptoms are and what their possible disease may be and the possible cures to enhance their lives and so they can be fruitful and pain-free. We go through a process to diagnose your symptoms. We would do a model analysis of your teeth on a jaw machine just like this, with your teeth on here, and we see where your bite may be off, and then we can start to make a determination of what we can do to correct it. That's the first thing. The second thing is we do what's called a JVA, or joint vibration analysis. That analysis is a computerized electronic screening that measures the noises and vibrations that are found in your joints on both sides. And when we get that data, and data of the noises and data of how far you can open your mouth, how much you can move it left and right, we can determine what level of TMJ you may or may not have. And then we can determine exactly what we may have to do to help you become comfortable and with the final course of treatment. In this office, we believe in not only educating our patients, but we really believe in educating ourselves, and by that I mean myself and my entire team. We take hundreds of hours of continuing education classes on a yearly or bi-yearly basis, well beyond what the requirements are for the State Board of Dentistry in the state of California. We feel it's the cornerstone is to continually become educated so we can help our patients be as comfortable and healthy as possible.